Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to demonstrate for you how to crush a medication when you're giving it through a tube feeding or orally. So what is the purpose of why we crush medications? Well, number one, if a patient has a tube feeding, we need to crush the medication into a fine powder so we can instill it through the tube so it can get to the stomach. Or the patient just has trouble swallowing big pills. They get choked on them. So we have to crush it and either mix it in water or some type of food like applesauce. So let me demonstrate for you how to do this for a tube feeding or orally, and then I'm going to follow it up with some tips of some things you want to keep in mind whenever you're doing this skill. Okay, first let me demonstrate for you how to crush a medication to give through a tube feeding. Okay, first, before you do this, you always want to follow your hospital protocols and how much water you will be giving before you give a medication, in between medications, and after medications, because each hospital has a strict protocol on what you follow for tube feedings for medication administration. And the following supplies you will need a pill crusher, whatever you have access to. You will need a medicine cup because you will be putting the medication in that after you crush it into a fine powder. You'll need a 60 cc syringe, enteral syringe that will connect to the patient's tube so you can easily give the medication. And you'll need warm water per pill, about 20 cc's of warm water that you'll mix each medication in to give, and then you'll need a pair of gloves. And of course, before you do this, you do hand hygiene. And always put your gloves on whenever you are crushing medications, because you're breaking these medications down into where the chemicals are, and you do not want to get these on your skin. They can be dangerous. Okay, so you're going to get your pill crusher, make sure you have the right medication, the right patient, check everything off before you start doing this. And for this particular crusher, you just stick the medication in the bottom, and we put this on top, and then we just twist it. And as we do this, it starts to crush the medication. And you twist it until it can't go anymore, and then untwist it. And then just try to get that residue off at the end. So you're making sure you get all the medicine in there. And I like to just wipe it in there. And then empty it into your medicine cup. You got to make sure it doesn't stick on the sides, especially if you're using one of these kind of twist type crushers. Okay. Then what we're going to do is we are going to instill some water in our medicine cup and mix it up really good, and then we'll draw it up. And just stir it, because you want everything stirred up very well so it doesn't stick in your tube and cause your tube to become clogged, because a clogged tube is no fun for you or the patient. And you will crush each pill separately. You never crush medications together, because when you crush them together, it will break down that protective coating and those chemicals will mix together and affect their ability to work. It can decrease their effectiveness. And then you're just going to draw up with your syringe the medication. And sometimes it likes to settle at the bottom, so you've really got to stir it to make sure you can get it all up in there. Okay, and I like to get the air out of my syringe. Slowly push it up there, put your cap back on, and then you're ready to instill that into the tube. And you'll give that and then flush behind it, and then repeat your next medication. And if you were using a type of crusher like this, you would need to clean all the residue off, wash it with warm soap and water before you do the next medication, because you don't want to mix medications. And that goes for if you're going to be using this for another patient. Now let me show you how to crush medicines to give orally. Okay, with this, what you can do is you'll mix the medication with either water, or here we're going to use applesauce. A tip is not to use the patient's favorite food or something on their food tray that they're going to be eating, like green beans or something like that, because these medications, when crushed, taste horrible and you don't want to ruin the patient's food. So what you're going to do is you need to get your pill crusher. You need to get some applesauce if that's what you're going to use to mix it in, a spoon, get the right pill for the right patient, and then your gloves. And of course, before you do this, perform hand hygiene and put your gloves on. And put your pill in your pill crusher. And use your pill crusher according to how you're supposed to use it. And again, you crush pills individually because you don't want to mix them together because they can affect how they work. And typically what I like to do is I like to use 1 spoonful of applesauce per pill, and then just repeat with however many pills I have, because you don't want to mix 1 pill in a huge thing of applesauce, because if you have to give 3 more pills, that's a lot of applesauce that patient's going to be eating. So try to use the smallest amount of applesauce as possible so you don't fill your patient up. So we're just going to put it in there, and be careful you get all of the contents in there. Okay. And remember, you will clean your pill crusher in between medications and in between patients if you're not using a closed system crusher. And you will mix this up, try to mix it up as good as you can so patients aren't getting big chunks of pills in their mouth. And once you have it mixed good, administer that to the patient and then repeat as necessary. Now let me give you some quick tips to remember whenever you're crushing medications. Tip number 1, remember that not all medications can be crushed. And if you're ever unsure if a medication can be crushed or not, always call pharmacy, because they're great in helping you determine if you can crush it or not. And as a nurse, whenever you work overtime, you get experience, you will learn what you can and can't crush. And another thing is to look at the medication's name, because a lot of medications, they will have the name and then they'll have these letters after the name, like Detrol LA. LA stands for long acting. You can't crush that. And there's typically 5 categories of drugs that you cannot crush, and they are enteric-coated, long acting, extended release, controlled release / delivery, or sustained release / action. And to help you remember those 5 categories of drugs, remember this mnemonic. Seniors erroneously crush enteric-coated laxatives. And this will help you to remember it, because a lot of times patients who are taking crushed medications are your seniors, your elderly patients. And seniors, the abbreviation for seniors is SR, so that's sustained release. Erroneously, ER is for extended release, crush, CR is for controlled release, and then enteric-coated is for enteric-coated, and then laxatives is for LA, which is long-acting. And the last tip is to try to consult with the physician or the pharmacist on trying to get the medication switched to a liquid form or an IV form, so the medication doesn't have to be crushed. And that may be possible if your patient just doesn't like swallowing their pills and they rather have it in a liquid form. But if your patient requires like nectar thick liquids or honey thick liquids, that they may not be a candidate. But always just try to consult with other parts of the team to see if you can help the patient out. Okay, so that wraps up this demonstration on how to crush medications. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.